improvements, or we see if we have changes. And so we generally see that people have what are called minimally clinically important differences at about that time frame.
Hey everyone, my name is Dr. Nick Housley with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
So what is a typical experience? I guess I would want to know.
Yeah, that's a fair question. I'd say that what was described is much more of an atypical experience. I think that when you look at our randomized controlled trials and the clinical trials over the decades, unfortunately, we don't have great granularity of the assessments just based on the way that the NIH kind of forces us to do clinical trial design. But when we look at how those studies are designed, we have a 3-month epoch in which we're looking. So we do a pre-assessment at basically baseline, and we do a post-assessment, usually 3 months, around 100 days after the fact. And that's where we check to see if we have improvements, or we see if we have changes. And so we generally see that people have what are called minimally clinically important differences at about that time frame. And that's a fancy word. MCID is the sort of acronym there. But that MCID is an important metric, right? It's not just a statistical change, but it's a meaningful change that you or I could detect without any sort of fancy gadgets. And so at about 3 months is when we typically see those changes. That being said, as you well know, Darlene, many stroke survivors are different, and the rate change of improvement can be very different as well among individuals. And that's dependent on a lot of different factors. One of them is time since stroke, not to mention the time you can put into it. And so there's a lot of factors there, but I would say that typically that kind of 3 month, kind of in the 100-hour range is where we would start to see some meaningful progress in terms of functional changes.
Okay, so let me just make sure I understand what you're saying. So if I were to go ahead with this program, if I don't see some change in 3 months, I should probably give up. Is that what you're saying?
That is not what I'm saying.
Okay.
I think, yeah. So this is one of the challenges, right? So with respect to improvements, we need to disentangle functional improvements from sort of, I'm going to call them foundational changes.
Okay.
And let me just describe that in a second. So a functional thing is fairly easy to understand. Something, and I always give this example, is like picking up a cup of coffee, right? That's a very functional thing. I have to reach out and pick up that cup of coffee and complete that task. I'm going to disentangle that from the foundational elements that help build to that functional capacity. Things like range of motion, things like strength, precision of motor control, these sorts of things, sensory motor functions. Now, these are the sort of elements that we can measure with high fidelity. And what's really challenging is that the functional tasks happen in a stepwise way, right? There's very little like granularity between being able to pick up this cup of coffee and drink it and not being able to do it. There's a strict sort of delineation there where we have I can do it and then I can't do it. But what's nice is that the functional or the foundational capacities are continuous in that sense, right? I can measure a continuous scale of strength and range of motion and an actual precision of motor control. And those things, as long as we're seeing improvements in those capacities, we would have strong indications that we are still making progress. We just haven't like put those things together to unlock new function at that point. So I'd say that under certain circumstances, we may want to discontinue at 3 months, but I would say it's not a ubiquitous statement that if we don't see changes in X, Y, or Z, then we should stop. What I like to say in these cases is, because we have data, because we have sensors on board, we're measuring things with high fidelity, we can know when you're making progress and we can know when you're not making progress. And I would say a good condition for return is we have done enough in terms of the amount of time where we would reasonably expect to see some changes in some measures. And if that's true, and we have made some tweaks in terms of the algorithms or the actual intervention itself, and sort of, there's a bunch of knobs that we can turn with respect to rehab, the frequency, the time, the intensity, et cetera, et cetera. Now, if we don't see changes with respect to turning all those knobs, we've kind of turned over all the stones, if you will, then we would have a reasonable, like a justified reason for returning at that point. We'd be reason for stopping. But I would say very, very rarely does that happen because there's a lot we can do. And the vast majority of people are seeing improvements in terms of those metrics.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro rehab.
Okay, so
Yeah, does that make sense, Darlene?
it does. Even if you maybe can't get to a point of being able to drink a cup of coffee with your opposite hand,
Sure.
your affected hand, what is its effect on spasticity?
Very interesting. It's a good question.
Does it help at all?
Spasticity, yeah. So with respect to, I'm going to call this broadly the topic of tone. And technically, I'm going to call it hypertonicity, because even in an individual without a neurologic injury, we all have tone in our muscles. Okay. Tone is just a resting nature of a combination of just the structural elements of our systems, as well as the activity of those systems. So it's a combination of our skeletal, sort of musculoskeletal system, as well as the neurologic system. Now, what happens following an injury is those things can change. The structures can change, which can cause some resistance, increased resistance. That's classically hypertonicity. But we can also have changes in the excitability of our nervous system as we respond to movement. And that is classically called spasticity. In the definition, kind of, it's a velocity-dependent increase in resistance to movement. That's the kind of, open up the textbook, and that's the definition. Now, how do we help people have, help people with those types of impairments? And it's a really good question, and it's actually quite complex. But I'll say the reason I'm parsing them out is because on the tone side, or the hypertone side, where it's not necessarily velocity dependent, by nature of doing a lot of repetitive movements and getting a lot of assistance to move, because there is a metric on board that can actually help you move and provide long, low stretches to you, that will help try to improve the sort of passive structures in your muscles, not to mention just the extensibility of your muscles themselves. So we can improve those sort of tone components. Now, in terms of we'll call it the neurologic side of things, with respect to changing the sensitivities, a lot of that is rebalancing your systems, right? One of the reasons why you get this spasticity is because the sensory systems become hyperactive, right? There's a feedback loop, a reflex feedback loop that occurs mediated by a neuron that I've studied extensively called the 1A. So it mounts the stretch reflex, the monosynaptic stretch reflex, just some fancy words there. But effectively what has to happen is those systems have to be desensitized, if at all possible. And by nature of doing this feedback with, doing this training with biofeedback, you can learn to gain control over those systems again. And this is very much like what happens when we can imagine a neurologic system going through a de novo development, i.e. a young child. When a child is very, very young in infancy, these reflexes, these flexor withdrawal reflexes in the upper extremities and these extensor reflexes in the lower extremities are native. And what has to happen is our supraspinal segments in our cortex have to gain control over them. And oftentimes those things get dysregulated following stroke or neurologic injury, and we have to regain that control. And so by nature of doing these movements with feedback, you can relearn the mapping of control from your cortex volitionally to control those systems. And so by nature of doing that with feedback, you can help to relearn how to gain coordination of that. The other really important thing too is by nature of working on sort of uncoupling movements, right? You probably experienced this, Darlene. One of the classic problems is you have this coupled movement, right? When you get spasticity, it might kick on your fingers and then kicks your wrist in and your elbow, right? It's coordination across the whole upper extremity. But what we want to try to do is we want to try to uncouple that, because so much of our daily life requires you to be able to independently move your wrist and your fingers and your elbow. And so by nature of working on these things independently, you can work to discoordinate those muscles and those movements, which is normally a bad thing, discoordination. But here we want to uncouple those movements.
Right.
So hopefully that provides a little bit of insight in that.
Yes.
But yeah.
I mean, actually,
sorry, Darlene, go for it.
No, I mean, I have, my OT says I've done a really good job. Like, I don't have any contractures or anything. I better knock on wood, but because I've done a good job of doing exercises for the last almost 19 years. So I'm not like in a space where I have that issue, but
Good.
It grasps when you don't want it to, and it doesn't grasp when you do want it to,
Exactly. Yep. And it is a challenging thing to manage, I think. And the other thing too to mention too is that the tone, oftentimes we can learn to function with it, right? Especially if you know how to deal with a tenodesis grip, you might actually learn to function with it. But I'd say ideally we would want to try to gain back as much uncoupled volitional control as possible, right? That gives us much more fine control for upper extremity. That's what we really want to work on.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.